Hi, good morning.
Hello, I'm
I'm
Dr.
Rebecca.
Hamza Yusuf.
I'm Rebecca
Hey,
Petersen.
all right. Nice to meet you, Rebecca. I'm
It's
going
nice
to
to
be
meet
your
you.
guide and I'll be sure that I can help you to make a diagnosis, okay? So you should be able to see your patient and ask all the questions that you want to ask. So go ahead, please.
Well, hi. How are you doing today?
How student Rebecca, and she's asking how you are doing today. Okay.
So what brought you in?
Wai me yake damunka? Okay. He said he's been having this fever with associated headache, abdominal pain, and joint pains for the past 1 week.
Okay. How bad is this fever? Is it very consistent?
Wai zazzabin yana zuwa ya je ya dawo ne ko yana nan ko da yaushe? Okay, the fever has been intermittent. It goes and comes.
Okay. Do you live around stagnant water? Do you have a lot of mosquitoes?
Wai kama a gida biyu kana zama around ruwa ne sosai ko kuma akwai sauro around gidanku sosai? Okay. They have a lot of mosquitoes around in their home, but they don't have any stagnant water or any bushes around their home.
Okay. Have you been coughing?
Okay. Akwai tari ne? Okay, it doesn't have any cough.
Okay. Have you been feeling any dizziness, especially when you stand up?
Wai kamar idan ka tashi, kana jin kamar dizziness ne? Okay, sometimes he has some dizziness.
Okay. Any nausea, chills, vomiting, diarrhea?
Wai kana, wai kana jin kamar sensation ɗin sanyi wanda other people did not pass your school. Yes, kuma akwai kamar amai ko gudawa ko kuma wani abu haka. Okay. He doesn't have any chills or any vomiting or diarrhea.
Any nausea?
No, 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 no nausea.
Okay. You mentioned stomach pain. How bad is that pain on a scale of 1 to 10?
Wai ciwon cikin nan in ka yi rating ɗin shi kamar on a scale of 1 to 10. Nawa za ka scoring ɗin shi? Okay, he'll give it a 6.
Okay. Have any family or friends been feeling this way?
Wai akwai kamar wasu 'yan gidanku ne wanda suke da similar symptom? Okay, no one actually around him has similar symptoms.
Okay.
So, uh, would you like to ask if the patient has any uses a mosquito net when he wants to sleep, or if he uses any bug spray or insecticide at home?
Yes, if he takes any precautions, that would be great.
Okay. Wai kana kwana a net ne a gida ko kuma okay spray? Okay. Okay, he actually does not sleep under any insecticide nets, but he uses a box spray at home. And you can also go ahead to ask if what the source of his drinking water is, if he uses any water closet, or if he has any if he washes his veggies or any foods before he eats them. Okay.
Yes.
So would you like me to ask him all those stuff?
Yes, please. Thank you.
Yeah. So wai ina kake samun ruwan sha? Okay. Kuna tafasa ruwan ne kafin ku sha? Ku tafasa. Okay. So um he actually uses a water closet for sewage disposal, and his source of drinking water is mainly sachet table water. And they also have a borehole in their home, and they don't boil the water usually before drinking.
Okay.
Yeah.
Any sanitation? Do you wash your hands well after using the bathroom?
Yeah, actually, I asked, and he said he does wash them.
Yes.
Yeah.
Okay. Have you been eating well?
Wai appetite ɗinka is good ko kuma okay. He's been eating well.
Okay.
So, do you want us to tell you any results of any investigations that we have that's available?
If you have taken a blood test,
Yes, we did some blood tests.
and what were the results?
Great. We did a blood film that showed two clusters of malaria parasites. We also did a Widal test for typhoid fever that showed elevated titers for Salmonella typhi, which is positive for typhoid fever. So we also did a complete blood count that showed a hemoglobin level of 10 grams for the same day.
Well, because you are positive for malaria, I would like to prescribe ACT.
Okay,
And
perfect.
because you do have that fever, I would prescribe antipyretics to lower it
Okay,
and possible supplements for nutritional anemia.
okay. So would you like to prescribe anything for the typhoid fever?
Yes, antibiotics.
Perfect. So way she feels that because when you test mun ga cewa akwai two classes of malaria, she's going to prescribe ACT for you. Sannan kuma za ta ba da antibiotics for the typhoid fever. Sannan kuma she's also going to give you some antipyretics saboda zazzabin. Huh? Yeah. So I've actually explained the treatment that you've recommended to your patient. I don't know if you also like to talk to your patient about some preventive measures in case of future.
Yes. So for malaria, I would say to use some bed nets or to try killing some mosquitoes, just to prevent malaria from happening again. And typhoid fever, I would say to make sure to wash your food, try to keep up proper hygiene. And anemia, make sure you eat nutritional meals. And yeah, if you could tell him that.
Perfect. Yeah, perfect. Way tana so because to prevent future occurrence na malaria ake kwana a mosquito net, sannan kuma ake amfani da kaman insecticide, sannan kuma ake wanke hannu, ana shan ruwa mai kyau to prevent typhoid fever ko? Yeah. So sannan kuma a ci abinci mai ƙara jini sosai saboda to prevent anemia. Huh? Yeah. So I've actually explained everything to your patient, and he's also grateful for everything that you're doing. And he's also going to comply with all the treatment that you've recommended.
Mm,
So is there any other thing else you'd like to tell your patient?
I think I am good.
All right, then. So I like to say that you did very well. I'm very impressed with your performance. You were able to ask the right questions and you got the diagnosis right. So congratulations. Okay.
Thank you.
Yeah. So have a nice day. Okay.
You too. Bye.
Bye.